I'm on old age, I'm on CPP, and you only get a certain amount of money, as you well know, from both of them. By the time you pay for your rent, it leaves me with about $200 a month.
I am from Palestine, refugee claimant. I came to Canada before 7 months ago. Because I am a newcomer, I take assistance from Ontario work, but it's not enough. Cost of living here is very expensive.
Moving to a new country with kids, it's not easy, as you know. It was such a devastating time. Everything is double. Transportation, food and housing, everything is increased. We try to manage. We are doing our best, without government support.
I'm 35 years old. I run a nonprofit. I've been in the nonprofit sector for 15 years, and I currently have to access the food bank. So I'm a part of the cycle now. It's hard to see how we're going to be able to break free from it.
I'm 74 years old. Where am I going to get a job at 74 years old? But yet, if I don't try to maintain a certain amount of thing, I'm on the street. I don't have the fundings that the government should be providing.
We're getting a better sense this morning of how the rising cost of living is affecting Canadians.
The skyrocketing cost of living is difficult for both people who've lived in Canada for a long time and for newcomers.
Food bank usage is hitting an all-time high in Toronto.
And numbers aren't just up, they're at historic high levels.
More people than ever who actually have jobs, who are employed, are accessing food banks.
Just working through our food center here at ACSA, one of the biggest things that I've noticed is that there's just a bigger need for our food bank services here. There's just a lot of people that can't make ends meet due to like inflation costs for food, housing and transportation.
I came from my home walking because I don't have money to pay for transportation.
If someone's rent is increasing and their wages have not increased, therefore, they're spending more money on where they're living, less money on anything else, which then impacts all other areas of their life, their health, their wellness, their mental health.
People are resorting to food banks basically because financially wise, they don't get the funding of government that they should through whether it be old age, welfare, social assistance. Government is not providing that.
What I would like to see governments prioritize, understanding the root causes of poverty in Toronto, and these policies can work around affordable housing, decent work, education, social and community services, mental health services, and childcare services.
Government needs to improve, strengthen our local food system in order to, save our children's life.
Why isn't government looking at it and saying, this has got to stop? We've got to do something about these. We've got to support our own people.
We don't need to reinvent the wheel. We already know what the issues are. I literally think it's just like actually starting to take action.
Community services right now are running at full capacity, and there just needs to be a reallocation of funding and resources in order to support these services while policy is catching up, essentially.
We need our elected officials to take the poverty reduction strategy seriously and stop prolonging it when we need to get started.